Hi, today I'm making a video on how different organs of the body look on ultrasound when we place probe on different areas of the body. Uh, so, uh, so I'm going to explain that how different organs look when we change the props on different areas of the body. So this video and my all other videos are for educational purpose only. So keep in mind, okay? Thank you. So let's go.
To visualize these organs clearly, practitioners primarily use a 2 to 5 MHz curvilinear probe for deep structures like the liver, pancreas, and kidneys, and a 7 to 12 MHz linear probe for superficial structures like the appendix, liver, and gallbladder, right upper quadrant. Liver appearance. A normal liver appears homogeneous, uniform, and slightly gray, isoechoic to the spleen. You will see branching blood vessels. Portal veins have bright, hyperechoic walls, while hepatic veins have thin, dark walls. Gallbladder appearance. Located on the underside of the liver, it appears as an anechoic, completely black, pear-shaped, fluid-filled sac with thin, bright, hyperechoic walls. 2. Common bile duct, CBD, and portal vein, right upper quadrant. Probe placement. Epigastric, middle upper abdomen, or subcostal, angled obliquely toward the right shoulder. Appearance. Together with the hepatic artery, these form the portal triad. In cross-section, they look like Mickey Mouse ears. The portal vein is the large, round, dark face. Anterior and to the left of the vein sits the CBD, appearing as a smaller, tubular, anechoic structure with distinct, echogenic, bright walls. Using color Doppler, the portal vein will show blood flow, color, while the CBD will remain empty, black. Pancreas, middle upper abdomen. Probe placement, transverse, horizontal, in the high epigastrium, just below the sternum. The left lobe of the liver is often used as an acoustic window. Appearance. The normal pancreas is a gray, somewhat granular, band-like structure. It is usually slightly brighter, hyperechoic than the liver, particularly as it ages. Its landmark is the dark, tubular splenic vein, which runs directly behind it. Inside the pancreas, you may see the main pancreatic duct as a tiny, thin, dark line, usually less than 3 millimeters. Spleen, left upper quadrant. Probe placement. Coronal/intercostal approach on the far left side, usually with the patient lying in a right lateral decubitus, RLD, position. Appearance. The spleen is crescent-shaped with a smooth, bright outer border. It is highly homogeneous, appearing very similar in color and texture to the liver. Liver and right kidney, right upper quadrant. Probe placement. Coronal or sagittal view in the right flank. Appearance. You will see the interface between the bottom of the liver and the top of the right kidney. The liver will appear slightly brighter, or equal to, the dark renal cortex. The kidney's hallmark is its bright, echogenic renal sinus fat in the center, surrounded by the darker, hypoechoic, outer cortex. Appendix, right lower quadrant. Probe placement, transverse directly over the area of maximum tenderness, usually McBurney's point, or lateral to the umbilicus, often requiring steady, graded pressure to push away bowel gas. Appearance. A normal appendix is seen as a small, non-compressible, tubular, blind-ended pouch. It is /6 mm in diameter. In cross-section, it classically shows 5 alternating dark and bright concentric layers, the mucosa, submucosa, muscularis, and serosa. Urinary bladder, pelvis/suprapubic. Probe placement, suprapubic, just above the pubic bone, in both transverse and sagittal planes. The bladder must be filled with urine to act as a clear window. Appearance. The urine-filled bladder appears as a perfectly black, anechoic, oval or rounded structure. Its walls should appear thin and smooth. You may occasionally see tiny bursts of urine, ureteral jets, entering the bladder using color Doppler.